Good morning, everyone. Today I'm going to talk to you about my work for cardiovascular diseases, or I would say my work against cardiovascular diseases. I first decided to work in cardiovascular diseases, or rather in non-communicable diseases, in 2006 when I joined Eminence, a Bangladesh-based research organization. Then in 2007, a very loved one of mine had a heart attack. His cholesterol level was sky high, so the doctor asked him to be a vegetarian for the time being. As he couldn't do it alone, I decided to do it with him. I stayed a vegetarian till now. But it's a very personal story, it's a very personal journey that I became a vegetarian because of my heart health. But in my profession or professionally, I have been working with the World Heart Federation as Eminence is a member of the World Heart Federation for the last two years. And for the last few years, we have been successfully implementing or observing World Heart Day across the country, or very successfully in Dhaka, I would say. As a member of the Young Professionals Chronic Disease Network as well, we utilize the network members in Dhaka to do the World Heart Federation's activities, World Heart Day and Go Red for Women. The Go Red for Women of last year was one of the most successful events that I have ever done in my public health career. With all those experiences and all those small, I would say my small expertise in advocacy or small expertise in communication, I think I can contribute a lot in the Young Leaders program of World Heart Federation. Do I do only communication? Well, no, I do have a wonderful team of very young people from anthropology, people from medical background, people from allied health professional, and me being a nutritionist. This wonderful team of people are working together to gather evidence, to train people, to do advocacy, to do policy-level communications. As a policy-level communications, me and my team were part of the Bangladesh Demographic and Health Survey, where we had collected data for more than 10,000 households for diabetes and hypertension. Hypertension being one of the precursors of cardiovascular and cerebrovascular diseases, were one of the most important indicator of the last Bangladesh Demographic and Health Survey. As a part of the commission, we also developed a policy brief coming out from that data. That policy brief has made a tremendous impact in the Ministry of Health and Family Welfare. With that policy brief, now the policymakers got to know that 1/3 of the people, both men and women, over 35 years of age are now suffering from hypertension. With this context, Bangladesh being in the brink of having double burden of diseases, both communicable and non-communicable, and with all its risk factor residing here, along with mine and my team's expertise and my organization's willingness to work against cardiovascular disease, I think from Bangladesh I can represent the Young Leaders program in World Heart Federation. I look forward for having your support. Thank you.